Hello, guys. So I'm here and I will send you guys the link. Hello, guys. We are having this live question answer session for the students, and let's see how many students join. And if you guys can hear me, please comment so I know you guys can really hear me. If you cannot hear me, then how would I know that you cannot hear me? Okay, Felicita, how are you? Thank you, thank you, thank you. So, guys, the time has changed. What I mean by that is the clock. The clock has moved forward. I'm not being, I am not saying it hypothetically. The time has changed. The time has literally moved 1 hour ahead, and that's why the session is a little late. But I want to let you know the next week's session will be on time. Will be on the new time. That will be California 10:30. California 10:30 a.m. so that everyone from any other part of the country has no confusion. I know in many countries this is the right time. This is exactly when we used to be live. But but now our time has changed. Our time has changed. So the class will be 10:30 California. So that means 1 hour before for everyone else because we have moved ahead an hour. And the next class will be actually on Friday because I will be traveling. I'm not here this whole week after tomorrow. I'll be traveling for a week. So I'll not be here. Next class will be next Friday. So I'm waiting for all the students to join. And of course, the students from other groups, they need to join as well. So guys, first of all, we'll talk about the orientation. Okay. So can you guys see me? Can you guys hear me? That's fine, right? Everything is good. So now guys start asking questions before we go on the board. I know we have a different setting today. We have a different setting because of a reason. I could not do that, the big board behind me today. So I said, okay, let's do a different setting today. And anyone has any question? I saw so many questions on the previous groups by the students about their papers, and so many students have already completed their papers, so you had some questions and concerns. So let's talk about this. Please type any question. when will our paper be published after we complete it? So that's a very, very good question. So remember, once you complete your paper, you have two options: whether to go with a rapid publication process through our channel, or go with a slow process. So if you go with free journals, they are very, very slow. They can take really long time, 3 months, 4 months, 6 months, 7 months, 9 months, 10 months. We don't know. But if you go through the channel, your paper will be published in just a matter of few days, maximum less than a month. But if your paper is really filthy, you haven't worked really hard on your paper, some basic mistakes are there, that means you have not been listening to us, what we have been telling you, then it may take 2 months. So it depends how serious you have taken your job, how seriously you have taken your job, how serious you were about your paper. So that's the main thing. Have you followed all the prerequisites of the paper? Does your paper have a wonderfully written introduction, a wonderfully written abstract? Does your paper have a great discussion section? And does it have the limitation section? Does it have the new question that I always talk about, that the students should discuss, should bring that new question in their discussion section as well? So those are the points that will decide. And the tables and the figures, do you have the tables, do you have the figures? So this is the question regarding an observational study, regarding a survey study. So first of all, you guys, all the enrolled students, you guys are supposed to do a traditional review or a systematic review or maximum a narrative review. Don't do a survey study. But if you are doing a survey study, first of all, the answer is yes, of course. More than one Likert skill, yes, of course. All the students who don't know what is Likert scale, let me tell you guys, Likert scale is a questionnaire where you all have seen that, where you have a question that how good you feel when you travel, for example. So you will say uh, best, good, bad, very bad, or like let's say strongly agree, like you enjoy eating food, strongly agree, neutral, disagree, strongly disagree. So that is called as the Likert scale. So make sure you guys remember that. Don't forget the word. It's a very famous word, especially for survey studies. In the future, you guys will do some survey studies too. Hi, Dennis. So guys, now let's talk about any other question. Anyone has any other question before I go on the board and I'll discuss a few things with you today? Dennis, you published so many papers since you started. You have published so many papers. There is a question that when will our paper be published after we complete it? Can you tell the students how was your experience and how they can publish rapidly? What can they do? What is your suggestion? What is your observation? Hi, Aisha. Thank you. So yes, Janice, we are waiting for you to type and let the students know what do you feel should be done. So now coming back to the point of the recent admissions, the new admissions. So guys, when you enroll, what you need to do is make sure you log into your account, you create an account, log in, and make sure you have the access to the course material. The course material will have the lecture notes, ebooks, exercise book, advanced research videos. Those over 130 videos, they are very, very important. So make sure you have that. Don't miss those videos. If you are taking your live classes and you are not watching those videos, you are not doing justice with this program. You are not doing justice with this program. So make sure you are utilizing all the resources. Anyone who still doesn't have the access to the videos, please let me know. Anyone who still doesn't have the access to the course material, please let me know. I think everyone can watch the videos, the advanced research videos, more than 130 videos. Now we have like 130, 134 videos, or probably more. We will add more. We are adding more and more, and I'm working on developing more and more videos because I want to. Tetsutan, now listen to me. Listen to me. The link. What link are you asking for? I said go on the website, cibnp.com, our website, create an account. On the account, when you create an account, on the top right corner, there will be a profile button here on this side, profile. You click on the profile button, and then at the next page at the bottom, you will see the Be a Published Author program. You click on it. You click on it, and you get the access to the lecture notes, ebooks, exercise book, and advanced research videos. So make sure you watch them. And you will attend your live classes. You will watch the recordings of live classes. You will meet with your classmates once a week. You will attend my live question answer sessions every Tuesday, and you will remain in touch with your mentor all the time. So make sure you utilize all the resources. If you are not utilizing all the resources, then you cannot get benefited from this program. So make sure you get benefited from this program. So Javeria, yes, this live session is for you, of course. Okay, can you make a video on basic case writing starting from scratch for beginners? We already have the course on case report writing. The one-day course. And I offered a deal that day for the students to get the case report writing course. We already have a full certificate course on that. We have a course on short course on traditional review writing course, the certificate course, and we have the case report writing, and I'm bringing more and more, and you will see so many good courses. And we are going to fill it up with so many courses. You guys will really, really be astonished. In our traditional review discussion writing, can we use same study more than once to be discussed? In our traditional review discussion writing, can we use same study more than once to be discussed in analysis part of different subhead? Why not? Why not? Reference number, let's say you start writing, okay? Let's say, where is my, okay, let's say you start writing. I'll use this. Okay, you are writing something, and here you have reference number 1. I discussed that in the session 2 weeks ago. And then you're writing something, the next line, reference number 2, then the next line, reference number 3. But now you need to use the reference number 1 again. Can you do that? Yes. Okay, now I'm on the board clearly. So now if you want to use reference number 1, can you use it again? Of course, but you will not call it number 4. You will call it number 1. Now you continue and you bring reference 4, then reference 5. Can you bring reference number 2 again? Of course. So yes, the same paper can be used anywhere. The same paper can be used multiple times. The same reference can be used in the whole paper again and again whenever you want. You can use it, but you will not call it as a new reference. You will call it 2, 2, 2, 2, 2, or 1, 1, 1, 1, 1. You can use it unlimited amount of times. You can use it unlimited amount of times. Does it make sense, Aisha? Did I answer your question? Are traditional reviews enough to be published, or is it required to write a systematic review? Both can be published really, really well. Some papers, no matter what you do, cannot be converted into a systematic review. Your research question decides if this paper will be converted into a traditional review, or if this paper will not be converted into a systematic review, or it will be converted into a systematic review. Your research question decides this. So remember, not every paper can be converted into a systematic review. Your research, and the experts know this, not every paper can be, and not every paper should be converted into a systematic review. And both can be published. One of the best papers of my career was a traditional review. So the quality matters. What topic are you bringing forward? What problem are you bringing forward? And are you giving a good solution? Are you bringing a big solution, good solution? That's what matters. So whether it's a traditional review or it's a systematic review, both will be published, and both can be published easily. Are traditional reviews enough to be published, or is it required to write a systematic review? I answered this question now. Would you please explain the umbrella review? Would you please explain the umbrella review, how we can review it? Umbrella review? What do you mean by umbrella review? What do you mean by umbrella review? What are you calling umbrella review? Let's look at it. Umbrella review, I never heard this terminology. So you're talking about the review of reviews. The review of review articles. That's what umbrella review is. Umbrella review research. Okay. Yes, so umbrella review is a term used for the review of reviews. Review of reviews. So yes, I discussed that in the videos, advanced research videos. When you watch the advanced research videos, I discussed that. And I have discussed in live sessions as well that when you write a review article, remember, review article can be of different kinds. A review article can be let's say a review article can be a review of clinical trials only, just clinical trials. A review article can be a review of randomized controlled trials. A review article can be a review of non-randomized controlled trials. A review article can be a review of cohort studies only. A review article can also be a review of case control studies only. A review article can be a review of cross-sectional studies only, just survey studies, just longitudinal survey studies, or cross-sectional studies. So, and this review article can be a systematic review or a traditional review. So simple review article or a systematic review. And can a review article be of review articles? Yes, and that's what the umbrella article is. That's what you are calling the umbrella article. And I do know some people use this terminology, but I usually call it as the review of reviews. Review of reviews. That's why when you said that, I couldn't recognize it. I couldn't recognize it because I don't use this terminology. But this is exactly what it is. The review of review articles. And can you write a systematic review of systematic reviews? Yes. Can you write a systematic review of meta-analysis? Yes, and it becomes a meta-analysis of meta-analysis. Meta-analysis of meta-analysis. Meta-analysis of systematic reviews. Systematic reviews of systematic reviews. Systematic reviews of general review articles. Systematic review of clinical trials. Systematic review of animal studies only. Systematic review of case studies only. Systematic review of case series only. So yes, you can have it. You logged into your account, but there is no video lectures. Please text me right now. Text me right now so that I can resolve this issue today. Because if you are missing those videos, then how will you learn to write? You cannot just rely on the live lectures. There are so many things that are not discussed in the live sessions with your mentor. If you miss my live question answer sessions and you miss the videos, then you will miss a great deal. You have to attend both sessions, my sessions and your mentor sessions, and you have to watch my videos, advanced research videos. If you're not watching it, you can damage your paper. Yes, of course, any future article, if you write any future article and you want to publish to our channel, you're most welcome. But every time you submit to the channel, there will be a rapid publication fee. So yes, in the future, you can keep using channel because you can get rapid publication, but make sure it's a review article, narrative review, systematic review, and make sure it's not the real patient data. And we will not be able to allow you to publish in the channel. So that's the story, guys. That's the thing. Javaria has a question. And where is that question? Can you please explain the difference between peer-reviewed and index review in PubMed? Remember, any journal article, if it's an authentic journal, when you submit your article to a journal, they send it to the reviewers team to review and comment, and those reviewers make the decision whether this article will be published or it will not be published. And if they don't send your paper to the reviewers team, then that journal is not a good journal. Then your article is not a peer-reviewed article. And it will not be considered as a scientific article. Will not be considered as a good article. So make sure that when you submit to a journal, make sure they do the peer review. And most of the journals who are on PubMed, they do that. Because nowadays you will not find probably any journal that will not go through a peer review process. Peer review process is that your paper is reviewed by your peers, by other scientists. That's what your peers are. So when you submit to our channel, yes, your article will be reviewed by the reviewers team. The journal asks you to provide some names, suggestions of the reviewers' names. And indexed reviews. Indexed reviews is no more any terminology. Is not any terminology. Just remember, peer reviewed is a terminology, and your paper should be peer reviewed in an indexed journal. Indexed journal. Indexed journal. Journals are indexed. Journals are indexed. Actually, in easy language, if I were to tell you what is the meaning of the word index, in easy language, the meaning would be licensing. Licensing. That you can say that if a journal is indexed in PubMed, that means the journal is in PubMed. The journal is licensed by PubMed, or you can say. Or you can say a journal is, this is even an exaggerated terminology. If I say that licensed by PubMed, no. You can say that the journal is in PubMed, or the journal is on PubMed website in their database. That means the PubMed recognizes this journal as a good journal. So if a journal is PubMed indexed, it means the journal will be on PubMed. If the journal is Google Scholar indexed, that means the journal is present on Google Scholar, and Google Scholar authorizes that journal, recognizes that journal as a good journal. So that's what it means. So indexed are the articles, indexed are the journals. You cannot even say that my research paper is an indexed research paper, because usually the journals are indexed and you publish your paper in the index journals. So when you select a journal, make sure your journal is PubMed indexed, or PubMed Central indexed, or Web of Science indexed, or the giant one, Medline indexed. So if your journal is not indexed in these four, if you are a medical student, then your journal is probably not a good journal. And many employers will create problems. Although I'm a person who doesn't believe in that. I believe in the quality. I believe on the quality. But residency program directors, if you want to make them happy, make sure your paper is indexed in these four: PubMed, PubMed Central, Web of Science, Medline. If you are going to the UK PLAB, you're doing PLAB and you're going to the UK Foundation or UK training programs, then your journal should be at least Cochrane indexed in the Cochrane library. Does it make sense now? Everyone is clear? Everyone is clear? Okay. Anyone else has any question? Because today we will talk about a very, very important topic, about the topic selection. How many people approximately needed for a systematic review? That's a very relative question. How many people are needed? I have seen a team of 2 people writing a systematic review. I have seen a team of 3 people writing a systematic review. I have seen one person trying to write a systematic review. He can do it. It can take time, but he can do it. I have seen 20 people writing a systematic review. The more the people, the easier and faster it becomes. And the problem is, now this is the problem, guys. The Prisma guidelines want at least 2 authors who decide the data collection, who go through the paper. So you, at least if you are 2 people, then yes, you are safe. So make sure you guys, can you memorize Prisma guidelines? If you want to keep writing papers in the future, memorize Prisma guidelines. If you memorize, although I'm not a supporter of memorizing, I'm just saying it as a joke, that do it too often, read it so often that the Prisma guidelines become the part of your life, and you can write a paper anytime, sitting whenever you want, wherever you want, you can write a systematic review. How do you write a systematic review? Just open Prisma guidelines in front of you. Just open Prisma guidelines in front of you. So Google Prisma checklist. Prisma stands for Preferred Reporting Items for Systematic Reviews and Meta-Analysis. And by the way, Nida and Javeria, the questions you are asking are already covered on the advanced research videos. So please make sure you watch those videos. You will miss unbelievable amount of value if you don't watch those videos. I have acquired that knowledge over the last 10 years, reading all possible books. I got another book yesterday, guys. I got another book yesterday. Read this book. Amazing book. Unbelievable book. I'm crazy about reading books on research. That's why I know that much. I keep reading books every other, and when this book is finished in a week, I'll get another book. I already ordered. So my whole life is, and my wife tells me that you are crazy. You're always reading. I said, yes, that's my life. If somebody else knows more about research than I do, then CIBNP will not be number 1. So I need to know more than anyone else. So please make sure, take a screenshot. Take a screenshot, buy this book, guys. This is very useful. Everyone took the screenshot? Author name. Get this book. Very, very, very economical book. $5 book. Only $5 book on eBay. Remember, guys, something changed my life. I learned this lesson 13 years ago. Yes, exactly 13 years ago. I learned this lesson. What was the lesson? That 2 kinds of people are never successful. Those who don't do what they're told to do. So what I'm telling you, what you're learning from this course, do that. Second are those who only do what they're told to do. So if you just stick to what has been told to you, if you just stick to what you're told to do, you will not be successful. Go extra mile, learn more, get some more information, get some more books, buy books, learn more. And especially after this training, you can read any book. You will find research so easy. You open any book and you'll say, I know this. Oh, I don't know this, but at least I know what he's talking about now. This is the benefit of this training, and especially after you watch the advanced research videos. And if you have already taken my research methodology course, if you have taken my research methodology course or the introduction to research course, the course I conducted last week and in February, the live session, if you have attended that course, then you can understand any book from now onwards. Okay, the course certificate and recommendation letter will be in the account after finishing the course. Absolutely. You can create your own certificate. But if you don't, then let us know. But you will not be able to do that for 60 days. That's how the system is. The system is very, very complicated. We have made it really accurate that the day you enroll and day you start your first class, you have to wait for 7 weeks to complete your paper. Only then you can you can download the certificate and the letter of recommendation. But this letter of recommendation is not the one that will be given to you for your eras. That will be different. When the eras time comes, let me know. That will be a customized for each of you. We don't create that. This letter of recommendation you can use at other places, but the customized one for the residency application, that's different. So just let me know at that time, and we will let you know. We will let you know when August arrives. We will text message all of you. We will tell you all of you that this is the time. Now apply for the letter of recommendation. Okay. So God, is it Isam? Is it Akin? Is it Akin? Akin is you, right? In your videos, there's a link for Prisma flow diagram generator, but that link doesn't work anymore. Really? Oh, thank you. Thank you for letting me know. I'll change the video. I have to create a new video now. Can you please text me? Can you please text me so that I remember I have to make a new video? I'll provide you a new link. Let's Google it, guys. Everyone, come to your cell phones. Let's Google it right now. I keep learning with you guys too. Let's Google it. Prisma flow diagram generator. Prisma flow diagram. Oh, it's here. Same thing. Prisma-statement.org. This is the website, guys. So you click on any of those, Word document or PDF. Word document. Go to Word document. You get the diagram. Okay, Malik, send me your email address. The course has already begun. When you this one-day training courses, research methodology, and when you purchase the course on the website, you will get the access right away. If you go to your profile button, you already have the access at the bottom and start watching the video. It's all recorded. It's all recorded. And the beauty about one-day hands-on research writing and research methodology is it's recorded from a live session. So you can enjoy a real live session energy. And one of the reasons I kept it like that is I could have recorded and I can still do it, but that becomes very boring sometimes. I am at my best when I have people in front of me. But in your flow diagram videos, you can custom. Yes, you can customize it. The same website. Okay, go to the website prisma-statement.org. So all of those who want to learn to draw Prisma flow diagram, go to this website prisma-statement.org, and it will show you this option: Prisma flow diagram PDF and Prisma flow diagram Word document. You click on Word document and start filling it out. It's customized. I don't know, then you're doing something wrong. It works for me here. Are you doing it on your computer or on your cell phone? Okay, it will work. It will work. Because that was actually astonishing for me, because this is an official Prisma website. How can it be jammed? No, you don't click on any link. You just click on the Word document or the PDF. So now, Prisma flow diagram and Prisma checklist is for those students who want to write systematic reviews. But trust me, guys, systematic reviews can take a lot of time. I will check. Guys, is Akin right? Does the website not work for all of you? Probably it's a country issue, because it's work here. It works here in the US. And your classmates can send you the Word document of Prisma flow diagram, you can just create it. So now coming back to the question, coming back to the Prisma flow. Prisma flow diagram and Prisma statement is for systematic reviews only, and make sure you start your paper as a traditional review. My recommendation to all the students is who have not written anything before to start with a traditional review. Don't start with a systematic review. Don't put yourself in extra trouble. Sasi says, I generated that diagram for my paper, but I did not include it because I was confused with dates. I have to mention. No, that's not a confusion. You should have talked to me about it. But isn't your paper published already? I thought your paper is published. Sasi, your paper is published, right? If your English grammar is really, really good, if you are very good at English language, and you have followed what we have told you, then you should take like maximum 2 weeks. If your English has problems and your paper has some problems, like one of the students, she wrote a paper. Let me tell you a real story. She wrote a paper and she went through the channel. So her paper was so unfocused. That it's been like 3 months since she submitted the paper and still hasn't published, because I'm now working on it. I'm making it better to make it focused. It was so much of information. It was so broad. The journal said, how are we going to publish this? So make sure, guys, it's to the point. Don't bring everything in the world and expect that to be published. Make it short. Shorter papers get published faster. That's the secret of publication. Write short papers. Write short papers. Sasi, can you answer the question, please? So anyone else has any question? Okay, now how to study. This is a very important point for all the new students. I have mentioned that before. Can anyone mention what I have taught you guys? What I have taught to you guys in the last few weeks, how to study. Can anyone share that information here so that everyone can read? And I will go and discuss that too. I'll go and discuss that too. I should have. I'm using my hands to clean it. Give me a second. Okay, I got it. Okay, so how do you study? And this is the board. How do you study for this course? Make sure you utilize all the resources. You are coming to your live classes. You are attending my live sessions, and you are following each week's plan. The first week plan is the topic selection. So are you ready with your topic selection? The first week plan is the topic selection. Are you done with the topic selection? How many of you have not decided any topic yet? Let me know and we will help you. That's why we are here. Topic selection is really easy, guys. It's really easy. Don't get scared of topic selection. That's the easiest thing. Okay, so see, I thought your paper was published. So what you need to do is you find a place where you write your research paper. Do you have that place in your home? Do you have that place in your home? Do you have that place, a library or anything? Can you find a place, a desk and a chair? You need to find a place. Where is the place? Do you have that place at your home? If you don't have a place where you have a table and a chair, then go to a library. Every day, if you can do it every day, then you will finish your paper really, really fast. If you just do that once or twice a week, you will still be able to do that. But ideally, if I were you, I would have invested my whole energy, my whole life for just 7 weeks into this paper, and I would have completed it and I would have published it. Because the paper is the number one factor now that will decide your future. Where is the place where you will write every day? You cannot just sometimes sit on a dining table and sometimes come in your bedroom and do that. You cannot do that. You cannot do that. Sometimes you come to your living room and sometimes you come in your bedroom, sometimes you come in your dining room. You cannot do that. You need to find a proper place. You need to find a proper place, a consistent place where you do it every day. And 2 hours minimum. Can you find a time in your daily schedule where you give 2 hours straight to your paper? No distraction, no sound. You should be at a place where there is no sound, no background noise. Can you stay away from family during those hours? Can you stay away from your cell phone? Can you stay away from your friends? Can you stay away from your movies and TV shows, or just those 2 hours? So you need to find a place. You need to find proper time, a place, a quiet place, a quiet place. Some students, they find their top floor in their home as the place where they will write papers. Some students, they find their basement as a secret place where nobody can bother them. And some students who don't have this facility, they are the luckiest ones because they can actually go outside to a library and stay away from family for a few hours and they complete their paper. You need that kind of laser sharp focus. So the place is the very, very important thing. If you don't have the place, you will not be able to finish your paper. If you don't have the place. That's why, Nida, do you have the place? Do you have the place where you can sit every day? Can you do 2 hours every day? Although if you do 2 to 3 hours per week, that's fine. But can you ideally give 2 hours every day to your paper at a quiet place, quiet time, and just 2 hours? Can you schedule it like 5 to 7 p.m. or 2 to 3 p.m., 1 to 2 p.m.? Maha, can you find time? Do you have the place? Do you have the time and do you have the place? Time is not an issue. You have to find time because this is the single most important thing, the research article that will decide your future. One of our students, she got residency in Canada. She got residency in Canada, the most difficult residency system in the world for IMGs. And because of her first author paper, she got Canadian residency. I heard this news just last week. And I spoke with her yesterday. Congratulated her. Canadian residency. Can you imagine Canadian residency? US residency is baby in comparison to Canadian residency system. IMGs cannot, it's impossible. People will not even believe that an IMG can get residency. Because when she applied, she had a first author research paper in a PubMed index journal. Residency directors are literally blown away when they see your first author research paper. So place, find a place. Where is your place? Maha, Nida? Is it even harder than interventional radiology in the US? Absolutely, it's probably equal. Just getting dermatology or dermatology residency in the US. If an IMG tries for a dermatology residency in the US, it's like that applying regular internal medicine residency in Canada as an IMG. It's that difficult because now IMGs, they are moving to the US. They are now from Canada, they are changing their plan. They're coming to the US residency system. So now, Maha and Nida, where is your place? Tell me the place where you will write. Guys, consider this as your family. These researchers, these classmates, they are your families. So you can be really frank. You can be very frank with all of each other. And many of our students, they find each other at different rotations. They probably sometimes do residency together. They never met each other. They were online classmates, and then they became residents together. So feel free to comment freely. Where is your place? Is it a living room? Is it your bedroom? Is it your basement? Is it your first floor quiet room? Where is that place? Or is it library? And now, if you cannot go to library, ideally, if you can go to library, I know in some countries library facility is really difficult to find. If you cannot go to library, here in the US, every city, every town has a library. Every time where I have lived in the US, 5 minutes from my home, there is a library. 5 minutes every time. You have a separate study room. This is exactly what we want. And can you get this? Earplugs. Can you get earplugs? Very good, Nida. Very good. And with that place, can you have the earplugs? Any medical store, any pharmacy can give you the earplugs. Any departmental store can give you earplugs. If you have earplugs, you will have no sound at all. You need quiet place to write an outstanding research paper. Guys, remember, this is a single most important thing of your life. If you consider it as a single most important thing of your life, then you will give it the single most importance in your life. Then you will give this project that kind of importance. So find these things, and no power on earth can stop you from writing your paper. And you need to develop the power of thinking and planning. Just like I'll explain. Just like when a movie maker, when a movie maker, when a movie maker makes a movie, he first thinks about the story. He first thinks about the story, that what will be the first scene, what will be the second scene, what will be the third scene, what will the story be like. So you have to just create this thinking power because you are writing a movie story. So you have to develop your story by thinking that this is my topic, what am I trying to prove? Okay, so first of all, I'll discuss this in my paper, then I'll discuss this in my paper, then I will prove this point, that this is happening because of this, this is happening because of this is not happening because of this, and then I will conclude my paper. Thinking capacity, your plan. And no plan is bad. No plan is bad. The easier the better, the simple the better. Journals want simple papers, easier to understand, easier to read. Don't make it complicated that sometimes you're going here, sometimes you're going there, sometimes you're going there, sometimes you're going there, and then you don't know now how do I organize it all. No, create a story. Okay, so now can we get residency being a first author without stellar step scores? In next 2 years, yes. There will be no step scores. There will be no step 1 scores, and the way we are going, there will be no step 2 scores. The only thing that will decide your residency will be the number of publications and the amount of clinical experience you get. So try to understand this. Research, publication will give you the residency. The residency directors will need some numbers to assess you. Where will they get those numbers? The numbers will be how many publications do you have? And now with this channel, you can keep publishing papers. Guys, give it serious effort, serious time, how serious you are about your life. Take absolute responsibility of your life. Remember, I have said this before, and I'll say it again, that anything that happens to you in your life, you are responsible. Stop blaming. If you are not getting the results you want in your life, then you are responsible. Change the input that you are giving to your life. If the life is not giving you the output you want, then you should change the input you are giving to your life. That means you are not doing this every day for your goals. Everyone has a target, and you need to find a place to achieve your target every day. Even one first author paper makes a huge difference, and especially if the paper becomes viral. Like some of my papers, they were covered in the news. They were covered in the news. And one of our students, he wrote a paper. Let me show you. Hold on. I have to find. Yeah, I found it. Look at this. This top paper, this was one of our students. Look, how many citations this paper got. This paper became a big hit. 19 citations as a first author paper, the first paper of his life, got 19 citations. Now, can any power on earth stop him from becoming successful? Can any power stop him from achieving his goals? Can any power stop him from living the life of his dreams? No. Because he gave all of his energy into that paper. He said, this is the life decider for me. 19 citations. Unbelievable. So now, as a first paper in your life, 19 citations is not a joke. So citation means that other people are publishing their paper and giving that paper as a reference. That's what citation means. You want to see that paper again? You know, when I bring the cell phone near it, look at this. Transradial versus transfemoral approach in cardiac catheterization. Catheterization. 2017. Just type it. Go on PubMed, find it. Beautiful. So the point I'm making here is that this guy had a separate place. Every day he could sit at that place with his earplugs on. Nobody could bother him. And that's how you study for your USMLE too. That's how you study for your courses and exams too. You need a separate place, separate time, no sound, with earplugs if necessary, and you need to think and plan that Thinking and planning is the must. Thinking and planning is the must for your paper. How your paper will look like, how many headings you will have, how many headings will you have, how many subheadings will you have, how many headings will you have, how many subheadings do you have. Guys, by the way, I just touched my face and I realized recommendation, coronavirus recommendation. If you have gone outside, although I haven't gone outside today, okay, I haven't gone to a place where I can meet people, so I can do that. But stay away from touching your face. Stay away from touching your face, touching your nose, touching your mouth, touching your eyes and ears, because of the coronavirus. Coronavirus is not spreading because of the airborne transmission. It's touchborne. It's touchborne. So make sure you don't touch your face. If really there is an urge to touch your face, make sure you have a tissue paper with you and then you touch your face. Can we visit CIBNP if we come to? Yes, absolutely you can, but there will be just administration office, administration staff, because our classes are online, and you will find me. That's all you will have. You will find me and our team, the administration team, those who reply to your text messages and your the phone calls and the emails. Maybe somebody who hasn't decided the topic. Maybe coronavirus transmission can be a very good topic. Mode of transmission can be a very good topic for research nowadays, especially it's a viral topic. So make sure you have this. Consider yourself as a movie director and you are creating a movie and your paper is your movie. You're just writing your story down. You're writing your story down, so make sure it makes sense. So if let's say you're writing a paper on coronavirus mode of transmission, then what do? You give an introduction. What is coronavirus? What is it has caused to the world right now? And it spread. All the prerequisites of introduction are there. Make sure that you have the benefits, you have the losses. If we don't solve the problem, what will happen? The problem is the mode of transmission. How to educate people about the mode of transmission. That can be the one. How to educate people about mode of transmission, or what is the mode of transmission? So now you come to your discussion. Don't worry about your method and results. You come to your discussion part and now just write like an essay. Transmission, mode of transmission number 1, touch. Water, drinking somebody else's water, eating somebody else's food. Whatever it is. So I'm just giving you that you bring the headings, and then later on you conclude that these are the modes of transmission of coronavirus, and we finish your paper. We finish the paper. The paper is done. So you create a story here in your mind that what mode of transmission I will mention first, then the second, then the third. First of all, you say, okay, how many mode of transmissions are there? You collected your data. You have your data in front of you. You say, okay, I have like 15 modes of transmission. Okay, which one will be my first heading? Okay, this will be my first heading, second heading, third heading, fourth heading, fifth. Nobody will ask you why you have this heading as the first heading. Decide any of the headings as the first heading. And then you have your 15 headings or 10 headings or 5 headings, and you write it down. That's it. Absolutely. I'm waiting for you guys to ask me as many questions as you can on WhatsApp. Ideally, if you leave an audio message, that's easier for me to reply, because when I'm driving, I'm busy. I don't have time to type. Sometimes I hate to type when I have like hundreds of messages. So I just leave an audio message. That's easiest for me. I'm a verbal person. So do you guys get an idea about how to create a story of your paper? How to create a story of your paper? Now, let's say if you're writing a paper, like, for example, I was writing a paper on occipital lobe and schizophrenia. That was my topic. Occipital lobe and schizophrenia. So occipital lobe and schizophrenia was my topic. So I collected the data, all possible information I could find on occipital lobe and schizophrenia in the last 5 years. When I saw that data, when I saw the data, I noticed that the data was divided into three categories: occipital lobe and schizophrenia physiology, anatomy, and chemistry. So I said, okay, wow, wonderful. I have three headings ready. And I included three headings and I wrote a paper down. Use common sense. Sometimes you can say, okay, probably I'll just keep one heading and I'll have just subheadings because just the physiology part is so big. If I include everything, it will become a huge paper. But if not enough information is available for each part, that means you can bring that in one paper. Classic review doesn't need separate SPSS analysis. Correct. If it's a qualitative review, you don't need that. I can be just like a Dawn article. Yes, now you got it. Like a newspaper article or like an essay. But you need reference. You need reference. In Dawn article, you don't need reference where you are getting this information from. But in a research article, you will give a reference to every source, everything you wrote, except the universal facts. Except the universal facts. Is there any tip to have such type of question where article can get such huge number of citations? Any suggestions on dermatology? Absolutely. First of all, your paper should be according to what we are teaching you. Everything, your introduction, your method, results, discussion, conclusion. Make sure everything is covered. Every point we have told you is covered. Second thing is make sure you have checked the grammar. There is no grammatical error left. Use Grammarly software for grammar check. Third thing is bring tables and figures in it. Make it beautiful. Can you make your article really pretty? Guys, just in the examinations, in your intermediate and matriculation examination, you remember you used to write exam in the exam hall. You used to write a 3-hour exam. There were no MCQs. You used to write answers, right? And what were the suggestions by the board, the metric board and the inter board? What were the suggestions? That the prettier the paper, the more score you get. Make sure your presentation is good. Make sure it is clean. Presentation counts. Presentation counts. Same thing. Your paper's presentation, how pretty your paper looks. How pretty your paper looks. Journals will immediately accept it, and when other people will see that published, because journal will make it more polished when they publish it. It will look prettier when it gets published. And more people will read it, more people will cite it. And then the topic of interest. Is the topic currently one of the most famous topics, viral topics? Is it in public demand? Like, for example, always write a paper on your passion. I always say that, but make sure your passion is in demand. Your passion is in demand. Don't write a paper. Let's say if you love a disease that is extremely rare, nobody knows about it. That's a very good topic too. But if nobody knows about it, nobody cares about it, then it will be difficult to get citations. You can still publish it, but you will get difficult to get it cited. But if you want your paper to be published faster and get more citations, use the topic in demand, the topic that is viral nowadays. And how do you find it? Just type the word, go to Google, type the word dermatology news today. So the moment I type dermatology news today, you know what did I find? Dermatology news. Let's see. The best way to wash your face according to dermatologists. Skin protection against coronavirus. Wow. Face wash. according to dermatologists. So face washing is nowadays in the news 21 hours ago. So you have one topic, face washing. Another topic you have is AAD cancels annual meeting amid coronavirus concerns. So can you bring something related to coronavirus and skin? That could be an outstanding topic. Dermatology Innovation Forum announces cancellation. That's useless. Dermatology and telemedicine. Beautiful topic. How do we treat dermatology through telemedicine, through skin? The skin treatment through the screen. That's a challenge for dermatologists. Can you see the screen clearly? The skin clearly through the screen. That's a challenge. So how do you make sure that the doctors can look at their patient's skin without any problem through the computer screen? Give the suggestions, give the ideas, read about it, and you can get more ideas. High quality cameras, high quality softwares, telemedicine. Now, how a dermatologist with hyperpigmentation keeps her skin clear. So hyperpigmentation, that's a topic nowadays in the news. Atopic dermatitis pipeline full of potential. Atopic dermatitis is in news nowadays. Just go and see what is being discussed, what is being written about atopic dermatitis. Global dermatology diagnostic devices. Wow, this is a good topic. Local dermatologist passes away. That's useless. Dermatology, well, very sad to see local dermatologist passes away, but you cannot write a research paper. If it's a world-renowned dermatologist, yes, you can write a research paper on dermatologists. Like my mentor, he was a dermatologist, and there is a research article written on his accomplishments. So yes, you can write it if it's an accomplished dermatologist. The best treatment for teen acne, treatment of acne nowadays in the 21st century. What would you recommend? Psoriasis is not in the news as of now, I can see. Kojic acid for the treatment of melasma. Kojic acid. What is kojic acid? Never heard of it. Dermatologists continue to prescribe topical antibiotics. Antibiotics in dermatology. See, unlimited amount of news in dermatology in last 12 hours. Last 24 hours. So I'm giving you the greatest secret to select a topic from any of those. See what is in the news. If you just write down cardiology news, see what is in the news today. You got your topic. Interventional radiology news, you select your topic. Secret of selecting ideas, that it is your passion and it's in the news. So make sure that the topic you select is your topic of interest and it's in the news. Then journals will grab it. People will read it. If you select your topic that is not in the news, then people will not get the give it the citation and the attention you want it to get. So psoriasis is not in the news as of now for today's news. Maybe next week, maybe next month, but not right now. Can sweat glands shed a light on disease severity in atopic dermatitis? Wow. This is a beautiful topic. Atopic dermatitis and sweating. Sweat glands. Is there an association? Sweat glands and atopic dermatitis. Beautiful. How to maintain a good dermatology practice income. Beautiful topic. Doctors' lives. Dermatologist residency problems. How difficult it is to get the residency in dermatology. Dermatology residency and IMGs. Off-label prescribing in dermatology. Acne awareness campaigns. Combination therapy significantly improves rosacea symptoms. Now you tell me, Is there a deficiency of topic selection? Is there a deficiency of topic selection? You select a topic and then start reading about it on PubMed. Now listen to me, this is very important. You select a topic from the news that is in the news, a viral topic, just read about it on PubMed. See how many new articles are about it. What are people discussing? And be open, be flexible, and then start thinking and planning. What will be my topic? Okay, I'll go in this direction. I'll go in this direction. I'll go in this direction. Skin problems in dermatologists. Do they have skin problems? What is the most common skin problem in dermatology and why? That's how you select a topic. That's one way. And watch my videos and advanced research videos on topic selection. Life-changing. The topic table approach. Topic table approach. So that's it for today, guys. Thank you for your time. Anyone has any question before I leave? Such an interesting session. I don't want to leave. I'm enjoying so much, but I have to go somewhere and I have a flight tonight. I'll be traveling and I'll be back in a few days next week. So I'll see you on Friday. So that's why the next session is not on Tuesday. It's on Friday. What is the date on Friday? 20th. Yeah, we can do this session on 20th. Okay, anyone has any question before I leave? Nobody has any question? So I think it's time for me to leave. Thank you guys. Thank you for your time. Thank you for attending this session. And I think you have gotten a lot of good ideas today. How to write, how to select your topic and start working on it. And watch my advanced research videos before your live classes begin for all the new students. And all the students who have already begun their classes, you should be able to decide your topic now. Thank you guys. Thank you, Nida. And thank you, Sasi and Akin, Ariba. Thanks a lot. Thank you guys. Okay. Oh, there were some questions. Do classic review articles have some checklists like meta-analysis and systematic reviews? No, they don't have. Call them traditional reviews. Don't call them classic reviews. Call them traditional reviews. And the checklist, use Prisma checklist. Just don't use the method part. Everything else you can include in your discussion section. Okay, that's the answer. Okay, Maha, thank you. Maha, thanks a lot. Thank you, Aisha Masood. Thank you, Aisha Masood. Thank you. And Malik, thank you. And now I will go back to the groups, and I saw a couple of students have submitted their papers. So let me comment on those, and I will see what is the situation. So that's it. Now, future, for your topic selections, whenever you are in a mood to write something, just type what's in the news and enjoy the process and see how fast your paper will be published. Journals will be crazy about it. I'm telling you this greatest secret in the world. Journals will be crazy about it, because if you write something that's in the news, that means it's in the market, it's in demand. Common sense. If it's a fashion of Nike, then you present Nike shoes. If it's a fashion for Adidas, you bring Adidas. If it's a fashion for tie, you bring tie. If it's a fashion for bow, then you use a bow tie. Do you understand what I'm saying? Stick with the fashion. What is going on in the market? What is going on today in the news? So make sure you follow that. Thank you guys. Thanks a lot. Best of luck. And if you have any question, you have my number. Okay. And see you next Friday on the 20th. Give me 10 days. We will have the live session the Friday the 20th. Thank you guys, and have a good day and best of luck. And hopefully now everyone will decide their topics, and text me if you are stuck or if you have any problem. Thank you.